the maracas, I go chick, chicky, boom, chick, chicky, boom.
Welcome to No Laughing Matter with Cuba Pete, a show that takes a critical look at the disparities between medical school education and society's growing healthcare inequities. Join Dr. Pedro Cuba Pete Greer each episode as he interviews the experts working to transform medical education and ensuring that future doctors are trained to provide equitable and compassionate healthcare for all communities. Dr. Greer received the Presidential Medal of Freedom in 2009, honoring his dedication to providing health care to underserved populations. As Dean of Roseman University College of Medicine in Las Vegas, Dr. Greer is committed to creating a medical school of the future where students embrace the need to unite the heart and science of healthcare. And now, the host of No Laughing Matter with Cuba Pete, Dr. Pedro Cuba Pete Greer.
Well, good day, everybody. How are you? I'm Pedro Joe Greer. They call me Joe, and welcome to Cuba Pete. That came from the Pedro. It's No Laughing Matter. It's about the intersection of society with healthcare and healthcare education, how we can do that to reform it. Rarely does one have the opportunity to meet a person like Dr. Sherin. I got to meet him in Cuba, of all places. We were there on a MacArthur tour, and we actually got to meet the very first Cuban rap group. Remember that?
Yes, I do.
And apart from being this spectacularly brilliant individual, when I say that, I do not hold back on brilliant, but it's just not his brilliance. I mean, this guy, let's just put it on the line. Brown, scholar in residence at Harvard, MD, PhD from University of Chicago. These are not schleppy little programs, okay? And currently, he happens to be the founder and CEO of the Eudaimonia Group. Sorry about that. And what does that mean?
Aristotle's term for human flourishing.
Eudaimonia, got it. Okay. See how brilliant he is? I can't even pronounce a damn word. He's the chairman of board of advisors for Vanna Health, chief medical officer for Healthy Brains Global Initiative, a member of the board of directors of the Treatment Advocacy Center, volunteer clinical professor, UCLA, USC, and Roseman University.
Amen.
He wears that little 6 on his lapel because of his experience in working with veterans and running VA psychiatric programs and mental health in Miami, my hometown. Jonathan, what was it, about a year ago you stepped down, did you?
Yeah.
Was the head of mental health for all of Los Angeles County, a $3 billion a year budget in a city that actually supports doing things for it, as opposed to most communities that don't. Jonathan, what do you see as the number one public health problem in this country?
I think the number one public health problem is the decrease in connectedness between people, which leads to isolation. It leads to more poverty. It leads to what I call the other LOL in unfortunate cases, which is the lethality of loneliness.
Wow, okay.
And I would say that while treatment is critical, and I'm a doctor, I'm a neurobiologist, you're a doctor, no one would argue with that, it's community that really is the solution. And when I say community, I'm talking about people, place, and purpose. So in other words, I don't care who you are, if you're a billionaire or if you're in one of the tunnels here in Las Vegas without a place to live. You need contact with other folks if it's a family of origin, if it's a support group, kinship. You need a place to live, a place to relax, a place to recreate, and needed a purpose in your life. And it may be that purpose is actually the most important thing because it tends to drive those other domains.
Being the way our country is right now, as partisan as it is, and as quick as people are to judge others, how do we change that here?
Well, I think we have to recognize, first of all, that, as I have said and used to use a lot, when speaking publicly in LA County that none of us are well until all of us are well. So in other words, and I believe COVID really demonstrated that, because COVID kind of demanded that we think about and look after our neighbor in terms of respecting distance, wearing masks, trying to control, a pandemic. But when we think about mental health, when we think about addictions, when we think about physical health, we have to take a collective lens in terms of how we develop our programs. We can't simply look at individual people. We have to look at families. We have to look at communities. We have to recognize that the interdependence between people is fundamental to their well-being. And if there were a solution that was simple, we would have already found it. But I will tell you, one of the things I work on the most, not just in the States, but also globally, is payment reform. We spend so much money and time exhausting our bureaucracies to take care of medical charts and auditors. Auditors don't tend to be my biggest friend because I'm not trained to take care of an auditor. I'm trained to take care of human beings. And so are the wonderful people in the front lines. But we need to liberate them from bureaucratic processes that are driven by funding streams that are segregated, they're fragmented, and they don't come together to ensure we're getting outcomes.
And having said that, I mean, basically, I agree with you. The vending machine has to change.
Yeah.
That's most important. But we're not preparing doctors for a change in the vending machine. So as medical educators, it becomes incumbent upon ourselves that we look at the future workforce of physicians, not only as preparing them for this, but taking the lead in making these changes.
Yeah.
And I could tell you right now that legacy schools aren't going to change.
Yeah.
So it gives us the opportunity of new schools to be able to do this, of which, one of the great outcomes of having met John is becoming his friend, and I am honored and humbled by that. He's also a surfer, by the way. Okay, and I explained to him I'm Cuban. We only surf once, and that was to get here. And after that, we didn't do it anymore. But it's an issue of we need this change, and as an educator, what do you see we should do?
Yeah. Well, I'm going to embarrass you a little bit because you already have done that to me. You, sir, have pioneered the importance of social determinants as much as anybody on this planet. And when you told me that you were coming out to Las Vegas to found and develop a new medical school that would focus on social determinants, I was like, how can I help? I'll do anything to be a part of that movement because I believe in the movement and I believe in you and your leadership, which is really unprecedented.
Well,
so,
I don't know about that,
well, I do. So you're going to have to deal with that.
You talk to my mother.
All right. We have to help, I think, young clinicians understand that it's not just about treating a sign and symptom. It's about dealing with a human being and the context of that human being's life.
Yes.
So when I teach psychiatrists, I'm often asked, well, what's the right medication? What's the right dosage for that problem? Hey, it's not that simple. And frankly, the medications aren't that effective. They are effective, and there are new preparations that I think help out with things like noncompliance. But that's not what you do in the healing art. The healing art is much more comprehensive. So even if you're looking at someone that has a mental health diagnosis or an addictions diagnosis, how are they physically? How are they intellectually? What's going on in their family? What's going on in their community? What's going on with them spiritually?
And what we do is in medical school, we teach things by disease.
Yes.
For example, I try and explain to some of the younger physicians, you can't teach diabetes. What do you mean? Well, if the diabetic is the CEO of an international corporation, you talk to their chef.
Yeah.
If they live in the tunnels, how do you even get medicines to them
Yep.
or the appropriate diet? So all of a sudden, a disease with different complexities means a different therapeutic intervention.
Yep.
And unless we train them to think that way, that life in medicine, like you said, it's not an algorithm.
No.
You know, even though that's the way we were taught.
Yeah, that's true, and I think that is changing. I think we're starting to recognize the impact of multiple factors, and the interaction between organ systems. And
Oh, I know that as a gastroenterologist. I'll tell you that right now.
there you go.
80% of my patients' complaints came because of behavioral health disorders.
Yeah,
You know,
no, that's right, and I'm actually really interested and motivated to try to push some of the work that you and I are looking to pursue, where improving kind of the circuit function in brains can have an impact on that other brain known as the GI tract.
yes. Actually, I think it was the brain that paid my kids' college tuition. I remember having them all come in because of that problem. But one of the things that Dr. Sherin is talking about here is that he is coming up with some incredible ideas of things that we can do in this state to improve the mental health, number one, for the region, and number two, very interestingly, something that we've all been interested in, and particularly John, is the incarcerated population. What is it's estimated it's over 50%, 60%, 70% have a substance abuse problem, and most probably have a dual diagnosis of mental health. Imagine if we could treat them. Imagine what it would cost to save money to have them becoming functional citizens again.
Yeah.
And we also have to look at our judicial system. I was just reading a piece in the Miami Herald, because where I'm from, where teenagers, juveniles, for the same felony as adults, when they're tried as adults, get almost twice the sentence.
Yeah.
So where are we going to be equitable in how we distribute, punishments and us to take care of these kids?
Yeah, I mean, we got a lot of industrial complexes that are headwinds in
Yes.
terms of making progress. That's for sure. And
For-profit prison systems really are.
yeah, they're up there.
Yeah.
So is I don't want to get too political here, but there are others, including the housing industrial complex. But at the end of the day, a lot of people who are sick and behave in ways that don't kind of suit our public will end up in jail and cycle between jail and the streets. And in LA County and in many other places, there are some really progressive reform movements to recognize that care is the missing element, not punishment. So you need to nourish people who are sick, not punish them.
And we see that in the school system. By punishing a kid, by suspending a kid, their chances of graduation go down, down. And so what ends up happening, you have an uneducated kid, ends up on the streets or ends up in the prison system. And it's a cycle.
It is. I mean, a lot of pipelines, and that's exactly what happens. And then those kids who are in the child welfare foster care system will end up in probation, and in probation that will lead to incarceration and homelessness. And the statistics are staggering about how consistent those phenomena are.
But you and I both know that it's not easy to be a parent.
No, it's not. I just before I came in, I was talking to my 28-year-old daughter, a lovely therapist, and she continues to require my care.
I have kids like that too. But don't worry, mine are pushing 40. And now I got a granddaughter, so I can deal with that one too.
Well, there you go.
It was funny. My daughter just came back from a conference on authoritarianism in Rio. So Janice and I were babysitting the baby, and she's comes back, and I said, "So, was this because you're concerned of the future president, or is it because of your daughter? Because I had her for 3 days, and I'm tired of being told what to do." So.
Yeah, I do want to touch back on the jails and the prisons again real quick, and that is just to say, first of all, the amount of treatment, the quality of treatment in those institutions is generally pretty abysmal. And even if you had the best possible treatments, in that setting, people are not going to heal. So the concept of treating someone in an environment that is not conducive, be it the street or the jail, is oxymoronic.
Yes.
And I call these the asylum of our day, the outdoor asylum of the street, the indoor asylum of the jail, which is where people are now living who used to be in asylum that we deinstitutionalized 50 years ago. The key, again, gets back to what I was saying earlier, which is community. We have to develop inclusive communities for people with any kind of a disability. That's actually an ethical responsibility of us as a society. And we have to figure out how to get that done to scale. And we have to recognize that we're so far behind, especially in our urban centers, where there's great disparity in terms of wealth. And that's going to require a massive amount of investment because we've deferred it for so long.
The disparity is unbelievable. They have what they refer to as the subway measure in New York, where by taking the subway from Manhattan to the Bronx, survival rates.
Yeah.
Just by every 20 minutes you're on the train.
Yeah.
And where we used to live in South Florida in Coral Gables, there's a street called 8th Street that on the north side is the city of Miami. On the south side is Coral Gables. The south side has a 15-year longer survival rate.
It's unreal.
Than the other side. Education, employment, that whole sense that you're talking about. But having talked about that, last time I was there, we were sitting on the porch, and I would say 5 of every 100 people would actually wave back. We're talking 20 yards to the sidewalk.
Yeah.
People don't interact.
No.
I mean, I love it when I get in an elevator. I just look at everybody and say hi.
Yeah. Yeah.
What do you? I mean, you're sort of like facing 5 people, and I'm surprised when somebody says hi back.
Right, and you had asked me earlier to start this engagement around what is the biggest public health challenge, and I think that really is it. And I said to my staff in the Department of Mental Health in LA County, which is about 6,000 people, almost every time that I presented to them in town halls, and we had a lot of them due to COVID, that every day, let someone into traffic. Let someone get in front of you calmly and make eye contact with them. And if someone lets you into traffic, acknowledge them and thank them, wave to them. And if you have a chance to open a door for someone, that's an opportunity to improve the connectedness index incrementally. And if we all did that every day, it would have a replication type effect. And those are the kinds of things, I mean, they may not sound terribly clinical, but if we start to build our society around doing that, the healthcare is going to improve and the well-being index is going to start to rise.
And if we can teach doctors to have that same aspect as opposed to walking in and thinking that we're the king or the queen, and bring back those virtues of humility, of empathy, of compassion, of caring, of transparency. I mean, these are not difficult things.
They're not.
And we want our medical school to really push those values. And the most important thing that we're trying to do is academia and higher education within itself is a very toxic environment. Academic medicine is doubly as toxic. So how do you produce people with virtues that come in with the virtues?
Yeah.
And we help take them away.
Yeah.
To make that, because if they're going to be at the front line, they have to be the example for everybody else.
That's right. And I mean, that's one of the things that you talked to me about when I first met you is humility and empathy. And the concept of hierarchy can be quite counterproductive.
And remember when we got to med school, what did they tell us? We're the brightest and the best.
Right.
And all I could think of was Einstein. If only he had gone to med school. How successful would he have been?
Yeah.
But he messed up. He didn't get in.
Yeah.
Well, I want everybody to know that I have not only the utmost admiration and respect for John, but I consider him a dear, dear friend, to the point where he can hang out in my house whenever he wants, and he does. And it's an honor to have him here. And I want you all to know that he flew out from Los Angeles this morning, and he's flying back home today. And we really want to thank you. But I got to get you a place to stay here, because I got to make you a Vegas resident so we can make these changes.
Yeah, well, I mean, I come out here because I believe in your mission, because there's such an incredible opportunity to knit together health and human services more effectively and lift up those who are suffering the most. and to have the medical school and this new mentality define a culture to get that done. And I'm honored to have been welcomed onto your faculty as a volunteer professor.
Are you kidding me? If I could have you here full time, I'd have you here full time.
All right.
But the problem is the world demands Dr. Sherin. So I would refer to him as a visiting professor because he's all over the world consulting. And with that, this is Cuba Pete and Dr. Sherin saying, thanks for listening. It's really simple what Dr. Sherin just told us. Say hi to somebody. Look at somebody in the eye. Open their door. Be courteous. It makes all the difference in the world. And you don't know what they've been through on that day. And just think of one act of kindness, of one smile, can actually make somebody's day better. So with that, enjoy the hot Vegas summer, or the wet Northeast, or the hurricanes coming into the South. Whatever you're going to enjoy it. John, thank you for everything you do, but most important, thank you for being a friend.
Thank you, man. Thanks for having me on.
If you enjoyed today's podcast, please subscribe, like, and comment on your favorite podcast platform. If you'd like to support the groundbreaking work that Dr. Greer is doing at the Roseman University College of Medicine, please donate at the link below. Thanks for tuning in to No Laughing Matter with Cuba Pete, as together we work to unite the heart and science of healthcare to serve all in our communities. See you next time.